What would you guys tell somebody considering other centers or just trying to determine if IVF is the right course for them?
Come to Dr. Silber. I've researched, I've investigated, I've read until my eyes have popped out. At least if you're in the situation that I'm in. Again, it's the methodology. I stand firm with his belief in pumping a ton of medicine is not going to get you a better quality of egg. You'll get more, no doubt. You'll pay more, you'll feel more, you'll go through more, but you're still, at the end of the day, going to put your body through a lot of unnecessary medicine and injections and time.
It's talking to family, friends, the support system, and just doing your homework. I mean, there's an individualized plan that they created for us as well. So although we saw a lot of family and a lot of friends potentially in here, and you kind of feel like you're coming in as part of a routine with the fresh batch that's coming in every single month. You actually have this personal experience as well. So that's really the difference we saw. And we did some research on all the other options in town.
And we visited. We didn't take this lightly.
After 4 or 5, when we weren't as successful as we thought, we were not going to kid ourselves. We started looking around to see, hey, is there another combination out here that works better for us? And we ended back to Dr. Silver. So we ultimately came back.
Everybody tends to have everybody fits in one box. And they'll tweak a few things here or there, but honestly, Dr. Silber, out of 8 times, we repeated once, and it was only because I fought to have a cycle that, was it Lupron that they were having the issue with, and then people were ovulating prematurely.
Right.
But that was the cycle that I had the best response. So at our 6th retrieval, I said, all right, here's the deal. However this one goes, I have one more left of me. I have one more fight, and I want to do this retrieval. And at first, Dr. Silber, to his defense, kicked back because he didn't want us to go through all that, to have nothing, and to ovulate early. And I said, you know what? I'm really, this is just, that if it falls on me, it falls on me. And he walked out of the room, and he came back in about 10 minutes later, and he sat down, and he said, you know what? You're my patient, and I'm going to listen to you. And we're going to do it that way. And he let me. Now, most people, especially with his expertise, would have stood his ground and said, I know what I'm talking about. You need to trust me. I do this all the time. But he didn't, and he let me have my way, and now I have a 9-month-old baby from that cycle that he tweaked just for us.
Really fantastic.
So.
Yeah, it's fertility is so unpredictable sometimes that you really have to listen to the patient's desire. So I don't want to be, like they talk about knife-happy surgeons or over-aggressive or pushing people. But if someone is really determined, we go for what they think and what they feel. And it's shocking and exciting, some of the surprises we get, with really low prognosis patients. We have a lot of those. People stick with it, and we get high pregnancy rates with no offense, the worst cases.
That's all right.
The nightmares.
I had the best response, so it's all right.
Well, we were looking at, I think, 15% chance with 1 egg and 30% chance with 2, and I think you were being nice to us. I think okay. And, so, with all those odds tilted against us, it worked out.
And no complications with your pregnancy?
I had a ton, but it had nothing to do with IVF. Yeah, no, nothing to do with
The
it.
delivery was actually
The delivery was the
15
best
minutes.
part.
It was the easiest part.
No,
Yeah.
I went into preterm labor at 18 weeks, and I had to have my cervix stitched closed, which is called a cerclage, and I was on bed rest for a couple months.
That's very, very important. It's not a higher risk with IVF, but I really think it's terrible to not go to you have to go to a high-risk OB.
And that's the thing. We had a team of doctors around us. My child will know every single one of you because that's the reason why he's here.
If you had a premature rupture of membranes, say at 20 weeks or 24 weeks, you'd have no baby.
Right.
But they do the cerclage.
Miracle.
And it's so simple to do, but they often don't do it. So you have to have in fact, general OBs are afraid to do it, but a high-risk OB, it's not a big deal.
Yeah, and mine, he does it again, I had a great team of doctors. We would not have a child if it weren't for the people that got us there. I mean, that's the reality of the situation. We were blessed.